Welcome back to America Lifestyle Show. My name is Kirby Lammers, filling in for Kevin Price. Talk 650, powered by CBS Radio. And our next guest is Dr. Michael Leesom. And who are you, Dr. Michael Leesom?
This time I get to talk all about myself.
So. All about yourself. It's time to be conceited. It's
okay.
All right.
All right. Well, I'm a psychiatrist that practices what you might call neuroscience, or disorders of the brain that affect behavior. I have done way too much training. I was 32 before I finished all my training. It was inclusive of an NIMH, National Institute of Mental Health, which is part of NIH, research fellowship, and from 85 to 87. So I was all set to be a researcher, academician, climb the academic ladder, publish papers, publish or perish. Came back to Houston. I'm a Texan. I was born in Austin, raised in Houston. Went to UT undergraduate medical school. Year of internal medicine at one of the Dallas Southwestern programs. 3 years of a residency at UT Houston and Herman when they had 80 psych beds and had the best training in the world. Under Dr. Louis Feliz, who was the youngest, at the time, youngest chairman ever appointed to a major academic department. And been chairman there 17 years. At any rate, I came back 32 to be an assistant professor, and 2 days later, in 87, 7 chairmen were fired. He was one of them. And it was tragic for the medical school.
Sure.
Especially tragic for me, because I was a man without a country, and I tried to stay for 2 years in academia, but when you're that close to your mentor, it just isn't going to fly. So I accidentally ended up in private practice because people kept calling me and wanting me to run inpatient units because I'm essentially a hospitalist. I treat very sick patients. I'm passionate about treating patients that have primarily psychotic disorders or perhaps a metabolic disorder that's presenting as a behavioral change, and so they need to be closely evaluated. So all of my medical training comes in very handy.
Absolutely.
And so currently what we are doing, or what I am doing, is in '89 I started backing away from academia. Jim Claghorn, who had started one of the first private research clinics here in Houston, or in the United States, it was a major academician himself at TRIMS. He was vice chairman of TRIMS, Texas Research Institute for the Mental Sciences. Left there in '81 and started CRA, which was a private research clinical trials practice. In 1994, Jim and I had crossed paths. We worked together. He's about 20 years older than me, and he said there were very few people that were qualified to take over his research practice. And as I said, he's about 20 years older than me, so he was ready to start backing away. And I did take it over in '94, and primarily focusing on inpatient studies, but also outpatient studies. Jim was more of an outpatient study person, helped develop Prozac and Wellbutrin, and Effexor, quoted on the front page of the Wall Street Journal when Effexor was approved. Called it Prozac with a punch.
I see.
At any rate, it's all sort of, to me, it seems like a series of inadvertent accidents that have led me down this path. But all along, I've hired people, and we now have about 20 to 25 staff that are primarily psychiatric nurses who are my coordinators, and they're the hands-on people to run the studies, overseen by the principal investigator, who is either myself, Dr. Alan Caddick, who's a Harvard-trained pediatric psychopharmacologist. He's also boarded in adult psychiatry. I'm boarded in adult psychiatry and geriatric psychiatry.
I see.
And then we have a third doctor who's a child psychiatrist who has worked at the clinic as a coordinator before she went back and got all of her child credentials.
Wow, so your clinic is really broad in the age group, from young to old.
Yes, it is. And we treat patients. We do lots of outpatient work, and we do inpatient work. We are very well known. We're probably now one of the oldest CNS research private clinics in the United States. Central nervous system, meaning in a sense applied neuroscience. So we do a lot of early drug development for big companies like Pfizer, Merck, Novartis, Forest. I do a lot of consultation, help them help them write the best protocol to show whether or not their medicine works or not. And all through this, we have to follow good clinical practice, GCP.
Absolutely.
Which is FDA mandated, which only makes sense. But, these are patients, they're human beings, they're not guinea pigs. And anybody that's in a study, whether they get the study drug and get a whole lot better and move ahead, or whether they get a placebo and don't do so well, whatever's best for the patient is what we'll do. So if they don't do well in the trial, we'll stop the trial on my dime, on the clinic's dime, not the patient's dime. We will make sure that that patient is back on a medicine or medication that really helps them before we'll ever discharge them. At our 24-bed inpatient unit in the Heights, we keep it, it's in a neighborhood, it's very nice for the patients. They come in, they think they've checked into a 5-star hotel.
Wow.
But it's really, on the outside, it looks like it's part of the Heights and it's gentrification, but in reality, it's like a hospital. And we have all of our employees, nurses, research assistants, everyone has to be passionate, has to be motivated, love this work, love these people, not be afraid, but help. They are there to help them. That's what we're all about.
Very good. And I understand that you're looking to recruit some people for this study.
Yes, we are. There are 2 studies that we're doing right now that are inpatient studies. And one is for mania, acute mania.
Okay. And what is that?
That's when people usually have a history of being called bipolar or manic depressive, which is the same. And they have to be, if they're called bipolar, they have to be type 1, which means they can go from being depressed up to a high, which is either hypomania or mania. And it means buying sprees, you're revved up, you don't sleep, your thoughts are racing, you use poor judgment, you spend your life savings, you go out and buy 4 new cars that you don't even need. You go from being maybe a very shy person to a very outgoing person. You can become hypersexual. This can last from anywhere from a week to 6 weeks to can even go chronic, but that's rare.
Okay.
But we're looking for patients that are having manic episodes. September is a month in Houston where a lot of people that do have this disorder will start to go manic.
Oh, wow. Why September?
I don't know. I think it has something to do with the seasonal changes. There is some data about that. It could also have something to do with pollen count. It has the same tissue that makes your immune system, also makes your brain.
All right. To be accepted, do you have to go through a doctor to?
Yes, you have to call our number and first see our talk to one of our nurses or outreach people. It's 713-965-7846. Let me say it one more time, 713-965-7846.
Okay.
If we don't pick up, we'll get back to you, leave your number. We're also doing an inpatient study for schizophrenia. These are both psychotic. I mean, you can be manic and not be psychotic, but many of the patients that do come in do have a form of manic psychosis. Okay. Schizophrenia, almost by definition, is a psychotic disorder. And we're looking for acute exacerbation of patients that have a history of schizophrenia that are between 18 and 65. Same is true for the mania study, between 18 and 65.
Okay.
And same deal. It's a little bit longer study. It's actually the same medication, which isn't uncommon, that you approve. You will be doing a study for mania and also for in schizophrenia. And many of these atypical antipsychotics when they get approved or approved.
Can you give me a short definition of what is psychosis?
Psychosis is a state that you lose your reality testing, and you start hearing voices, having visions. You have unusual behavior or thoughts. Your mood and your affect often are not the same. Inside you might be crying. Outside you look like you're laughing. You have very weird, paranoid thinking, ideas of reference. Everything relates to you. Special powers, special abilities. It's yeah.
I hear you.
And I don't mean that in a negative way.
I understand.
Anyone
would. Well, thank you for being on the show today, and thank you for your service.
Thank you for
and if you're looking to be recruited out there for this study, be sure and contact Dr. Michael Leesom. My name is Kirby Lammers, filling in for Kevin Price on Talk 650, powered by CBS Radio. You've been listening to America Lifestyle Show.
Thank you. I think that.